Hello, I'm Dr. Rafael Escamilla, professor in the Doctor of Physical Therapy program and director of the Biomechanics Laboratory at California State University, Sacramento. In this segment, I will be talking about the structure, function, and pathology of the radial nerve. The radial nerve originates from the brachial plexus. Specifically, it's the terminal branch and direct continuation of the posterior cord, which receives fibers of C5 to T1. It's a C5-T1 mixed peripheral nerve, meaning it has both motor and sensory. I want to start first by giving an overview of its motor function, which are the muscles that it innervates. In the case of the radial nerve, it's very simple. When you think of its motor functions, it innervates all the muscles in the posterior component of the arm and the forearm. In the arm, there's only one muscle. It's the triceps. There's three heads. Medial and lateral heads originate on the posterior humerus, and the long head originates on the infraglenoid tubercle, and therefore it also helps extend the shoulder. All three heads collectively insert into the olecranon, so its main function is to extend the elbow. That's the only muscle it innervates in the posterior arm. The other 12 muscles are in the posterior forearm. The way you remember this is there's 6 superficial going from lateral to medial, and there's 6 deep going from proximal to distal. So let's go over the 6 superficial ones first. Collectively, these muscles are referred to as the extensor supinator mass because it's descriptive of what they do. When you think of the muscles in the posterior compartment, they extend the wrist, they extend the fingers, and they extend the thumb, and they help with supination. That's their main primary functions. That's why they're called the extensor supinator mass. Now, to remember the 6 superficial, all of them have their origin on the lateral epicondyle except for the lateral first 2. The lateral first 2 are the brachioradialis, which originates on the lateral supracondylar ridge and going to insert into the styloid process of the radius. This is the only one that's not an extensor. It actually flexes the elbow, especially in a neutral forearm position like this. And it's a semi-supinator and a semi-pronator. So if you're in a supinated position, it brings you back up to neutral in pronation. And then if you're fully pronated, it brings you back up to neutral as you supinate. So it works effectively more in this neutral position, such as doing a hammer curl exercise. That's the brachioradialis. Then just medial to it is the extensor carpi radialis longus. It's just distal to the origin of the brachioradialis, but also on the lateral supracondylar ridge. It's going to insert into the base of the second metacarpal, so it crosses the wrist posteriorly and laterally. So it extends and radially deviates the wrist. All the remaining 4 superficial muscles originate on the lateral epicondyle and the common extensor tendon. So the third one over, again going from lateral to medial, is going to be the extensor carpi radialis brevis. This is the one that's oftentimes implemented in lateral epicondylitis or tennis elbow, and it's going to come up and insert into the base of the third metacarpal. So it's primarily an extensor of the wrist, slight radial deviation. The next one over is the flexor digitorum. It's going to insert into the extensor mechanism, which is comprised of your dorsal hood. You've got transverse and oblique fibers, a central tendon that comes up and inserts into the base of the middle phalanx. Lateral bands come off it and forms a terminal tendon that inserts into the base of the distal phalanx. So the tension through the hood is transferred to the extensor mechanism. By that way, the finger's extensor digitorum can extend not just the metacarpal phalangeal joint, but also the proximal and distal interphalangeal joints known as PIP and DIP. So that's the 4th muscle. The 5th muscle over is the extensor digiti minimi. And the way to remember that is it's the 5th muscle over from lateral to medial, and it's the 5th digit. It's going to also exert into the extensor mechanism and extend the little finger. And the last muscle, number 6, is the extensor carpi ulnaris, and it's going to come up and insert into the base of the 5th metacarpal, and it's going to extend and alternately deviate the wrist. So those are your 6 superficial muscles in the posterior compartment of the forearm, and their function. And there's also 6 deep muscles. So and they go from proximal to distal. So we're going to put the anconeus in as the most proximal forearm. Sometimes it's lumped in with the posterior arm, but we'll put it in the forearm, and it is somewhat deep. It attaches to the lateral epicondyle, and it's going to come over here to the ridge of the proximal ulna. So it helps the triceps extend the elbow. That's its primary function. So that's the anconeus, or anconeus as it's called sometimes. The next is the supinator on the lateral third of the forearm. It actually has 2 heads. One's on the lateral epicondyle, and another one's going to be over on the ulna, and it's going to come over and insert into the about 1/3 of the way down into the radius. So it's going to help supinate, especially when the elbow is extended. Is a more effective supinator. When the elbow is flexed 90 degrees, the biceps becomes a more effective supinator. So that's the second deep muscle. And then the 3rd, 4th, and 5th deep muscle, you remember them by the anatomic snuff box muscles. So this is your anatomic snuff box, little indentation right here. You push down through there, you have the radial artery, and you have the scaphoid bone as well. And then you have 2 tendons on the palmar side or volar side. And these 2 tendons, the one that's most on the volar side is going to be your abductor pollicis longus. Okay, it's going to come up and insert on the middle third of the radius, and it's going to come down, originate, excuse me, and then it's going to insert on the base of the first metacarpal. So it's in good position to abduct. This would be abduction of the thumb, thumb coming out away from you, at the carpal metacarpal joint. Then just adjacent to it is more on the dorsal side from it is going to be the extensor pollicis brevis. So it's going to insert on the middle third of the radius and come down and insert into the base of the proximal phalanx. So it's going to extend the metacarpal phalangeal joint. So this joint right here, metacarpal phalangeal, not the IP joint. That's going to be a different muscle. And that's going to be the 3rd muscle, actually, of the anatomic snuff box, which is your extensor pollicis longus. So that is going to come over here and originate on the middle third of the ulna, and then it's going to come over and insert all the way over here onto the base of the distal phalanx. So it's in good position to extend the thumb. If you stabilize the proximal phalanx, it can extend the IP joint of the thumb. And then you have one final muscle, your extensor indicis. It's going to originate on the distal third of the ulna and come over and insert into the extensor mechanism to extend the index finger. So that is a summary of the 6 superficial muscles and the 6 deep muscles of the posterior forearm. Now, as far as sensory goes, it's very simple. It's really also, think of the posterior upper extremity. So you have a posterior cutaneous nerve of the arm, sometimes known as the posterior brachial cutaneous nerve that innervates skin on the posterior arm, a posterior cutaneous nerve of the forearm, known as the posterior antebrachial cutaneous nerve. You have a lower lateral cutaneous nerve that innervates skin along the lower lateral part of the arm, so just below the deltoid down to the elbow in that region. And the last place is the dorsal web space, so on the lateral hand, in this area here, in the lateral 3.5 fingers. But on the fingers, it only goes up to the middle phalanx. Up at the distal phalanx on the dorsal side is the median nerve. So for the radial nerve, we're dealing with the dorsal web space and the dorsal aspects of the 3.5 fingers here. You have a higher density of receptors in the dorsal web space, so you're more likely to get abnormal sensation, pins and needles, numbness, tingling, more in this web space than anywhere else. So that is a summary of the motor and sensory function of the radial nerve.